Hi everyone, and welcome to the FMIG Leaders Series. This is our 15-minute webinar for FMIG leaders. This episode, we're talking about National Primary Care Week with our colleagues from AMSA. To start it off, I'd like to turn it over to our colleagues from AMSA to talk about what National Primary Care Week is and what great events they've got going on as the hosts of National Primary Care Week. And so today with us, we've got Kelly Thibert, who's our AMSA president, and Diana Huang, who is the AMSA Vice President of Program Development, here to talk about all the great things that they've got planned for National Primary Care Week. Just as a reminder, National Primary Care Week is in a couple weeks here, October 3rd through the 7th. Kelly and Diana, why don't you tell us a little bit more about what you've got planned for National Primary Care Week?
All right, thanks so much. As Kelsey mentioned, my name is Kelly Thibert. I'm National President of the American Medical Student Association. So excited to be talking to you all today. And I just want to mention a little bit about National Primary Care Week. And we're so thrilled to be partnering with you all once again. AAFP is always such a fabulous partner, and we have a lot of great programming lined up for you in the few coming weeks here. So as Kelsey mentioned, October 3rd through the 7th is National Primary Care Week, and the theme this year is improving access and quality for all. We will discuss hot topics as they relate to primary care, and we'll provide you with tools for education and advocacy that you can implement on your campus and in your home communities. We'll have webinars throughout the week, and most of the webinars will take place at night, but we will have a few at noon. So be sure to check out our website to see when these webinars will take place and which you can attend. I'm just going to go through a little bit of the programming that we have lined up for the week in terms of webinars. So we'll be covering different topics, for instance, advocating for maternal and child health in primary care, addressing the opioid epidemic, taking care of LGBT populations, primary care and the healthcare system, addressing mental health, and primary care and underserved populations. All of these webinars are free, and you can sign up for one or hopefully all of the webinars on the AMSA website. You can find us at amsa.org/events/NPCW for National Primary Care Week. I'm going to turn it over to Diana now, and she'll tell you a little bit about how you can get involved on your campuses.
Hi everyone, my name is Diana Huang, and I'm this year's AMSA VPPD, or Vice President for Program Development, and I'm also a fourth-year medical student applying into family medicine. You might be wondering, how can you incorporate these webinars into your primary care week at your school? So during the week, you can have your local speakers, like your family medicine clerkship director, innovators in primary care around your area, student clinic leaders, and other local representatives. And then have those activities at lunchtime and direct your FMIG members to join the AMSA webinars in the evenings when they're able to keep the conversation going and be able to benefit from the national speakers we have on those webinars. This is a great opportunity also to collaborate with your local AMSA chapters to increase attendance at your events. One example of collaboration between AMSA and AAFP is our upcoming podcast with Dr. Wanda Filer, who you may know as AAFP's past president and current board chair. At this year's AAFP National Conference in Kansas City, I was able to catch up with Dr. Filer, who provided her experience and insight into many issues, including the doors that family medicine can open for you. And she addressed the issue of primary care stigma, which many of you may think about, and also talked about how you can be an advocate for your patients with family medicine. You can download the podcast on iTunes or your preferred podcast app by searching for AMSA AdLib. Another way that AMSA can help you is if you want your chapter activities to be highlighted, you can email me at vppd@amsa.org with a description of your events, and we can highlight them on our website as well. Feel free to reach out at any time if you have any questions, and thank you so much for your time.
Great. Thank you, Kelly and Diana. It's great to hear about all the wonderful things you've got going on and how to get connected and really how to incorporate those things into what schools are already doing for National Primary Care Week. I'd also like to highlight a few other things that schools do for National Primary Care Week. We hear a lot from other schools about what they do during National Primary Care Week, and here are some of the best practices. One great idea, like Diana mentioned, is to announce the AMSA webinars or even to live stream one and have a dinner and discussion afterwards. Other schools have done things like physician lectures, panels with residents, panels with different members of primary care fields. There's been speakers about procedures, speakers about rural medicine, speakers about loan repayment. The schools have also put on procedure clinics, suture clinics, things like that. A couple schools are really involved and do some service activities, such as volunteering with Ronald McDonald or a food kitchen. Or one school even set up a health fair that takes place during National Primary Care Week, or a 5K for charity during the week. Some schools have done mixers with med students and residents in primary care, screened a video discussing primary care or some YouTube videos, and had a photo booth with pictures of why people want to go into primary care written on signs that they would hold up and that they shared with their school and on social media. You can also use some of the AAFP handouts, such as the presentations on the Affordable Care Act or patient-centered medical home, or some of the discussions that AMSA has, and work with other primary care groups on your campus to really collaborate and have a wonderful primary care week. So those are just some of the best practices that we've heard. I'm sure there's tons more that you guys do that we don't even know that go on, and we love to hear about them, as Diana said. You can email her to highlight those and let us know if you have questions or concerns. You can sign up for all the webinars like Kelly mentioned, and in particular I'd like to highlight that the AAFP, the American Academy of Family Physicians, is collaborating with AMSA and one of our board members, Dr. Marie Elizabeth Ramos, who's a board member, or board chair, board member, and a family physician, will be sharing about advocating for maternal and child health in primary care on Monday evening. So definitely check that out. Check out the podcast. Check out all the other events that we have going on this week. And you can check out more on the AMSA's website or the AAFP's website. Go to aafp.org/NPCW, also for National Primary Care Week. And sign up for things and check out our resources. Any final comments or last minute questions from Kelly or Diana?
I just want to say to make sure that you're tweeting and Instagramming all the great things that you're doing. We want to see all the fabulous things that you come up with because, as Kelsey mentioned, we know you're doing a lot and we want to be able to showcase you and show that you're all so amazing and such great leaders in this FM revolution. So make sure you hashtag NPCW 2016 and also hashtag AAFP and AMSA. We're looking forward to seeing what you all do.
Thanks for that suggestion, Kelly. That's great. And we'd love to hear and see what you guys are doing, and hope you have a very successful National Primary Care Week. We've got lots of resources for you to use. And best of luck to you all. Thank you for attending this webinar, and we'll talk to you guys later. Thanks for joining us.